All right, so this is my presentation on the social determinants of health. So when I say health, what does that make you think of? So for me, I think of hospitals, and it's not uncommon for our minds to sort of jump to physical health, such as illnesses or injuries. Generally, the word health, makes people think of hospitals, appointments, and other medical factors. Right now, your mind might think that health makes you think of COVID-19. So what are the social determinants of health? So for the purpose of this presentation, I'm just going to be focusing on the 8 that are pictured. So social determinants of health are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. So here are what are mentioned in the picture. So 1 is childhood experiences, 2, housing, 3, education, 4, social support, 5, family income, 6, employment, 7, our communities, and 8, access to health services. So here's a little video just to get started.
Canada is a healthy nation, but not everyone enjoys all the benefits of good health. These health differences are mostly explained by conditions in which we are born, live, play, and work. Also known as the social determinants of health, they include things like our income, housing, education, or job opportunities. Discrimination can make being healthy even more challenging. When some groups face barriers within these determinants more than other groups, this is unfair, and we refer to these as inequities. Some inequities may begin in the womb and continue throughout childhood and beyond. Canadian children living in communities with lower levels of education, employment, and income have lower chances of reaching their full developmental potential. Inequities continue into adulthood. For example, Canadians with lower levels of education, employment, or income are more likely to have diabetes and poor mental health. Ultimately, people with lower levels of education or income live shorter lives on average. Other social determinants also affect our health and well-being, such as food and housing. Certain Canadians experience food insecurity more than others. That means they are unable to afford the quantity and quality of food they need for good health. First Nations on reserve, First Nations off reserve, Inuit and Métis people experience higher food insecurity than non-Indigenous people. Black and Latin American Canadians experience higher food insecurity than white Canadians. Bisexual people experience higher food insecurity than heterosexual people. There are also inequities in access to adequate, affordable, and suitable housing. Recent immigrants are twice as likely as non-immigrants to live in housing that is unaffordable, too crowded, or in need of major repairs. Inequities experienced by First Nations, Inuit, and Métis populations are anchored in colonial policies and practices that included forced displacement into reserves and remote communities, the banning of Indigenous languages and cultural practices, and creation of the residential school system. Unaddressed intergenerational trauma adds to the ongoing challenges faced by Indigenous peoples. How do we address these inequities? By ensuring the conditions that support our health, such as good housing, income, education, employment, social connectedness, and access to social support, and health programs and services are equitably available to all Canadians. For Indigenous peoples, this would include addressing the calls to action as outlined in the Truth and Reconciliation Report and United Nations Declaration on the Rights of Indigenous Peoples. Doing this requires a better understanding of the current state of health inequalities in Canada. This information is now available in the Key Health Inequalities in Canada report and the Health Inequalities Data Tool, so that together we can create opportunities for all Canadians to enjoy optimum health and well-being.
Right. So that was the video. And oops.
Canada.
Um, sorry. So childhood experiences. So I'm going to talk about adverse childhood experiences. My screen share is being paused. Right, there we go. So I'm going to be talking about adverse childhood experiences. So adverse childhood experiences are stressful or traumatic events experienced before the age of 18 and were found to have a dose-response relationship with numerous poor health outcomes. And this is a quote that I found in an article I read. So it's time does not heal, it conceals, which I think is really important when talking about adverse childhood experiences because if a child ever encounters abuse, there's a higher chance that they'll grow up believing this is normal because they've just concealed it. You know, it didn't get to heal. And they can stay with them for the rest of their lives and they can get triggered by these situations in the blink of an eye. Sorry. And then the other quote I found from the same article was many of our most intractable public health problems are the result of compensatory behaviors like smoking, overeating, and alcohol and drug use, which provide immediate partial relief from the emotional problems caused by traumatic childhood experiences. So the whole article kind of mentions how individuals, if they witness abuse growing up, that they're more likely to perceive this as normal, or, you know, if their household promotes more drug use or different types of coping mechanisms, and they're going to grow up thinking this is normal. And another social detriment is housing. Determinant is housing. So housing stability, quality, safety, and affordability have all been believed to have a relationship with people's health. There are 4 pathways that make a connection between a home and a health impact. So the first one is stability pathway. So observational studies have shown that being without a stable home is detrimental to one's health. People who are chronically homeless face substantially higher morbidity rates in terms of both physical and mental health, and increased mortality as a result of that. Many people experience traumas on the streets or in shelters, which has a longstanding adverse impact on psychological well-being, and this includes children. The study included adults and children. So the second pathway is the safety and quality pathway. A number of environmental factors within a home are correlated with poor health. In-home exposure to lead adverse, the in-home exposure can lead to damage in brains or nervous system, and that's if they're exposed to lead in children. Substandard housing conditions such as water leaks, poor ventilation, dirty carpets, and pest infestation have been associated with poor health outcomes. Most notably related with those is asthma. The third one's the affordability pathway. During COVID, housing prices have skyrocketed. It's something that's definitely noticeable in the real estate market, but a lack of affordable housing options can affect families' abilities to make other essential expenses and can create serious financial strains on families. Low-income families with difficulty paying their rent or mortgage or utility bills are less likely to have usual sources of medical care and more likely to have postponed need of treatment, and they're more likely to ignore the treatment and focus on getting their bills paid rather than paying a medical bill. This is more so common in the United States. The fourth one being the neighborhood pathway. Most families want to be relatively close to their children's school or their work, and research has shown that a huge influence on neighborhoods and buying in a certain neighborhood is your physical surroundings. So this could be related to grocery stores, public transportation, your job, safe spaces to exercise. These are all correlated with improved health outcomes. Living in close proximity to high volume roads, in contrast, is a danger to your health and can result in increased rates of respiratory diseases such as asthma, again, bronchitis, and an increased use of healthcare. So another social determinant of health is education. So a lot of the articles that I read were discussing how COVID-19 has an impact on education. And one said that more than 80% of students worldwide have been affected by school closures, causing an interruption in education worldwide. So the school closures that are closing for such a long period of time have a disastrous effect on social health and health consequences for children, and will probably have qualities that'll last for most of their lives. So this could be they're missing relationships with their friends, so they're lacking social interaction. And this could even undo previous progress. So whether it be with legitimate school or with their peers and social interaction. And that kind of refers how to education shapes lives, because it provides structure and it provides social interaction. Without education, people wouldn't be able to break the chain in poverty or reducing socioeconomic and political inequalities. And there are actually some places in the world where they don't think that girls, like female students, will be able to return to school just as a result of their scenario. So another one is social support. Friends make the world go round, and a good social support system is crucial in ensuring a good quality of life. A social support system could be your friends, your family, your colleagues, your sport teams. Social support is so important to turn to in a time of crisis and build a positive self-image. They're good to give advice. They're definitely, if you don't have a good social support system, then there could be a risk for poor mental health struggles and whatnot. So family income. This is arguably the most important social determinant of health. So the level of income shapes your living conditions. It affects psychological functioning and influences health-related behaviors, such as some families can't afford sports and other extracurricular activities, so that has an impact on your physical activities. And even in some cases, income can affect the access you have to smoking or drinking habits. And for the next slide is employment. So having a good job and a secure one at that is a large component to the social determinant of health. A good paying job makes life easier. It makes it easier to live in a good neighborhood, and it makes it easier to make sure your bills are paid, that there's food on the table, and just gives you an overall better sense of financial stability. And then this goes to unemployment. So being unemployed comes with its own set of challenges, but a huge burden that it follows with that is stress. So if you're constantly stressed, that can have an impact on your health. Some of the consequences include headaches, constant upset stomachs, high blood pressure, chest pains, problems with sleep. Stress can also lead to emotional problems such as depression, panic attacks, and other forms of anxiety and worry. And obviously, if you're in a situation where you're not able to access healthcare and resources that you need to assist with this, then that can be an issue with your health. All right, and our community. So having a strong sense of community is key for a good mental health state. Residents who are socially connected to their community are far more likely to thrive. This gives you a big sense of security and belonging. And if you have trust in your community, then you're likely to have better health than those who feel isolated or marginalized, because if you're feeling isolated or marginalized, then that can lead to anxiety and depression, which, as I just mentioned, then if you're feeling isolated and you're feeling depressed, you're not going to be able to have, you might not be able to have as many good resources that are applicable to you, which leads into access to healthcare. So in Canada, we have good healthcare, and Canada is actually one of the healthiest countries in the world. So we're lucky for that. But good healthcare allows good physical and mental health, as I've mentioned a little bit earlier. Knowing that you have access to resources that will help you also reduce the stress, which, as we just talked about, stress is not good for your health. So there are two terms I want to highlight. So the first one is health inequality. So that refers to health inequalities that are unfair or unjust and modifiable. So for example, Canadians who live in remote or northern regions do not have the same access to nutritional foods and fruits and vegetables as other Canadians. And then health equity is the absence of unfair systems and policies that cause health inequalities. Health equity seeks to reduce inequalities and increase access to opportunities and conditions conducive to health for all. And there are a couple of ways we can help reduce health inequalities. So the first one is strengthening the evidence base to inform decision making. The second one is engaging beyond the health sector, and the third one is sharing knowledge of action across Canada. And these are my references. Right, and thank you so much for participating in my presentation on the social determinants of health. And I hope that you guys all have a great day.